This proof of vaccination is the peace of mind Dee Cannon has been waiting for.
I just knew I didn't want to get COVID.
With both shots out of the way, Dee is getting ready to check off what's next on her list, her mammogram. She gets one every May, like clockwork.
That's how we found my breast cancer in 2009.
But the breast cancer survivor and awareness advocate started to get concerned after learning the COVID vaccines could cause swollen lymph nodes and possibly triggering a false positive in mammogram readings.
And that's a scary thing to hear.
When we see a swollen lymph node on a mammogram, we don't know what the cause is.
Dr. Preeti Shah, director of breast imaging at VCU Massey Cancer Center, says lymph nodes are part of our immune system. They fight off anything that attacks the body. For the COVID vaccine, the swollen lymph nodes mean the shot is working. But in breast cancer, swelling in the armpit could be a sign that cancer cells have spread to the lymph nodes.
It's really, really uncommon for one or two swollen lymph nodes to be the only sign of a breast cancer.
Dr. Shah says that's when more tests would be done. With swollen lymph nodes coming up in the Moderna and Pfizer trials, and from some women experiencing the swelling after getting vaccinated, the Society of Breast Imaging is issuing guidelines for routine mammograms. Get a mammogram before getting the shot, or wait 4 to 6 weeks after your last dose. Dr. Shah says what patients shouldn't do is skip their appointment, especially if they feel something like a lump.
We would just want to avoid delaying a potential cancer diagnosis if we can.
Dee's doctor advised her to push back her mammogram. It's now in June. Another appointment she hopes will bring her peace of mind.
But yeah, I'll be at ease. And I'm glad I got my 2 shots. And so that's the main thing, too.
Another note about the COVID vaccines, Dr. Shah says any imaging test in men or women that includes the armpit may show swollen lymph nodes. For Buddy Check 6, I'm Reba Hollingsworth.